Namaskar. I am Dr. Kunja Medhi. I am Senior Medical Oncologist in Batra Hospital and Medical Research Center, New Delhi. On the occasion of Colorectal Cancer Month, I am going to give you a message and I am going to speak important point about the colorectal cancer awareness. March is recognized as a colorectal cancer month to raise the awareness about colorectal cancer worldwide. Every year, colorectal cancer cases are increasing and 100,000 new cases were diagnosed in last 1 year in India. Colorectal cancer is the fourth most common cancer in the world and it usually diagnosed in older population after the age of 50 years. However, colorectal cancer may be there in younger people also in less than 50 years. And in recent years, it has been seen that colorectal cancer is increasing in younger population in India. This cancer usually does not present in early stages because of lack of symptoms. Hence, most of the colorectal cancer cases are diagnosed in later stages of the disease. And the colorectal cancer can be treated with surgery, radiation therapy, targeted therapy, immunotherapy and all other newer technique of newer modalities of treatment. Now, we need to know what is colorectal cancer. The colorectal cancer is a type of cancer which may begin in the colon, that is the large intestine, and the rectum, that means the last few inches of the large intestine. It usually begins as a small benign clusters of cell that is called polyp in the inner lining of the colon and rectum. And this polyp, if not treated on time or if it is not removed, then some of these polyp may become cancerous and develop as cancer in colon and rectum. So, the colorectal cancer develop usually from some polyps. Now, we will discuss about the what are the risk factors for the colorectal cancer. The exact cause of colorectal cancer is not known. However, in general, there is changes in the DNA and that leads to formation of cancer, that is the healthy cells become cancerous cells because of some changes in the DNA in the cells of the colon or rectum. Cause of this cancer is, the exact cause is not known. However, some factors, the risk factors are implicated for colorectal cancer and these are, one is the first is the older age. Usually colorectal cancer is diagnosed after the age of 50 years, but below 50 years also in younger population also colorectal cancer may be diagnosed, and of late we have noticed that in India colorectal cancer is increasing in younger population. Second common factor is the presence of intestinal polyps and this may leads to colorectal cancer. Family history is also important point and some inflammatory bowel conditions are also implicated as a risk factor for colorectal cancer. Other some risk factors are the obesity, the sedentary lifestyles, smoking and alcohol consumption, and there may be history of radiation therapy. These are some risk factors of colorectal cancer. What are the symptoms of colorectal cancer? The colorectal cancer do not present symptoms in all cases. The common signs include changes in the bowel habit, there may be alternate diarrhea and constipation, there may be abdominal discomfort, bloating, pain or cramps and gas formation. There may be blood in stools, Bleeding from rectum is important signs of colorectal cancer. There may be fatigue, tiredness and weakness. This happens because of the blood loss and anemia, and weakness are because of the anemia. Unexplained weight loss is important signs. Feeling of incomplete bowel emptying is also a very common signs of the rectal cancer. So, when these symptoms are there, these signs are present, so we should suspect colorectal cancer and we should seek consultation from the specialist for diagnosis of colorectal cancer and further treatment. Now, after knowing the risk factors and the symptoms, we have to know how colorectal cancers are treated. The treatment options for colorectal cancer are surgery, radiation therapy, chemotherapy, targeted therapy and immunotherapy. These are the various modalities of colorectal cancer treatment. The factors that determine outcome of treatment are the age of the patient, the stage of the disease, the presence or absence of comorbidities. Left-sided versus right-sided colon is very important. This is discussed very widely nowadays. Then certain genetic changes like presence or absence of RAS mutation status, these are some important determining factors for the outcome of colorectal cancer. The good news is that with the use of biomarker testing, personalized treatment and correct treatment regimens, the survival in metastatic colorectal cancer is increasing. The most common treatments are surgery, chemotherapy, radiation therapy and other newer options include the targeted therapy and immunotherapy. One important question after the COVID era, most of the people ask about the COVID vaccination after colorectal cancer treatment. So, usually people ask about, can I take COVID-19 vaccine if I have colorectal cancer? The answer of this question is that cancer patients can be vaccinated against COVID-19 infection. However, it is important to talk to your doctor before you get the shot of vaccine. So, if you have undergone cancer treatment that suppresses the immunity, you may have to wait till your immune system is strong enough before you get vaccinated. Otherwise, you may have to wait for further for getting vaccinated. And at the last but not the least, with application of the newer diagnostic modalities including the nuclear imaging like PET-CT scan and more importantly the molecular diagnostic methods of diagnosing the various mutation and various genetical defect in the tumor and the newer treatment modalities like targeted treatment and the immunotherapy, the survival in colorectal cancer patients has been increased significantly and the lives are prolonged significantly. So, once it is diagnosed as colorectal cancer, nobody should be worried and should seek the proper treatment from the appropriate place, and with appropriate treatment there is cure, and if it cannot be cured, at least we can prolong the life. Thank you.